Hello, everyone in the Better Bones community and in the Alkaline for Life community. This is Dr. Susan Brown at the Center for Better Bones. Today is day 4 of our social distancing program where we're all working from home. Today's topic is going to be treating the root, not the symptoms. And I want to give you some local updates, what we're seeing here at the Center for Better Bones, and news we have. And then I'm going to talk a little bit about some of the news of how we might take better care around this current health situation, this current crisis. And then we'll actually answer a couple questions on bone too. So treating the root, not the symptoms. The groups I admire most around the world are groups that are actually looking to try to understand the problem and to solve the problem rather than covering the problem up, say, with a drug therapy. And in fact, that's what we do at the Center for Better Bones. We try to find the cause of bone loss. In Alkaline for Life, we try to find how to get the chemistry back into balance so we can have the best chance at optimum health. The group I want to highlight today is the Australian Bone Clinic. Now, you might have seen my blog on this Australian Bone Clinic. These 2 women down there at that clinic have shown that you can rebuild bone. They really busted the myth that osteoporosis can't be reversed. And they've written some nice articles. They have many case studies on their site, which is the Australian Bone Clinic. We're going to give you a link to the blog I wrote on that clinic. You can check it out. But the medical director there, Dr. Belinda Beck, recently contacted me. I've always been wanted to meet with her because she's done so much important work showing that you can reverse bone loss with strength training. And one of my clients, Jeanette Roth, actually is Australian. She knows Dr. Beck. She put Dr. Beck and I in touch. And I'm really so excited because we are going to do some interviews where we can talk with Dr. Beck about their research and what they're doing. It's really groundbreaking. It's showing that you can reverse osteoporosis. And all of you, I'm encouraging, if your bone health is great or it's not great, exercise is one of the most important things you can do, and building muscle will help everything from depression to bone. Interesting thing happened to Dr. Beck. We were all set up to do an appointment, and then they got struck by this crisis of this new virus, and so the clinic shut down. Right now, she, as everyone else, is hoping that this exercise center, like our exercise centers around here, can open up and weather the storm of this economic downturn. Just to tell you that at one point we'll be talking with Dr. Beck, the Australian Bone Clinic, people who really went to the root of the problem of why women may have some bone weakness. A big part of the problem is not giving enough physical exercise, not showing the bones they need to be strong. Another individual who has gone to the root of the problem many times is Dr. Jeffrey Moss. Moss is a physician, actually a dentist who turned into a noted nutritionist, and he actually is really introducing this concept of host susceptibility. Like if I develop osteoporosis, much less if I become infected and manifest symptoms of this COVID virus. Is there an issue of host susceptibility? Is everyone have the same vulnerability? And we, of course, taking the analogy of bone health, we know that there's very different situations. Some of our behaviors make us much more vulnerable to developing osteoporosis. And as we see, some of our behaviors, it's very likely make us much more vulnerable to having this viral infection become strong within us. Those factors for the viral infection, what Dr. Moss has looked at, could the possibility of certain drugs and medications be influencing our tendency to be more vulnerable to the virus? And it's a very interesting question. They're looking at some blood pressure medications, trying to figure out why does Italy and Spain, why do they have higher levels of fatality from these diseases? Dr. Moss will talk with us maybe next week. We're going to talk about some of his ideas, and basically the idea, does the individual host susceptibility make a difference in how we can improve our resistance to these diseases? One of the aspects that Dr. Moss is thinking about is drug therapy. You know, in this culture, we have developed this system of a pill for every ill, All we have to do is watch TV. We see it. Any problem, just take a pill. Some of these pills really can affect our vulnerability to disease. For example, all these pills that suppress the immune system, reduce inflammation because they suppress the immune system, very bad for the immune system when you get to a challenge like this. The particular drug they're looking at these days are these non-steroidal anti-inflammatories and ibuprofen. You might have seen the news report from the French Minister of Health who said, don't take ibuprofen if you have these symptoms of fever and pains from these flus, because they could actually make the flus worse by various mechanisms. Now, that's a really interesting thing to us because we've been looking at non-steroidal anti-inflammatories for a long time. They have a really big record of causing various problems. For example, let me see if I have it right here. Some of those problems relate actually to heart disease, to heart attack, stroke, a much higher incidence, and to even bronchial spasms. It's been known for some time that ibuprofen, for example, is associated with respiratory disorders and commonly causes a cough, and it weakens the respiratory system. I know many people with bronchial spasms associated with asthma, and definitely this ibuprofen is known to make that worse in many cases. So what Dr. Moss is talking about is looking at our culture of kind of trying to find the shortcut, just taking a drug instead of getting to the root of the problem, that may be catching up with us. So stay tuned, and we'll be talking with Dr. Moss about that hopefully next week, thinking of ways we can enhance our immunity at the same time, natural anti-inflammatories that can help us avoid having to use the non-steroidal anti-inflammatories. For example, here at the Center for Better Bones, for decades, I've used quercetin, high-dose quercetin with pomegranate, with some of these OPCs, like from grapeseed extract, a combination formula that's really very effective. Important to think, how can we naturally solve these problems without having to do drugs that might impact the immune system and impact our ability to fight viruses. The other things, another way to take a deep dive and look at the cause has to do with this fascinating question of pH balance. Those of you familiar with my work know that for decades I've studied the question of pH balance and how even a slight acidic tilt in metabolic acidosis can cause many cells to function in a suboptimal way. Like we don't produce protein as effectively. We aren't able to actually conserve minerals in the body as well. Our immune system is weakened. We immediately break down bone when we have even a slightly acidic tilt. I've written a lot about this. I have a book on it. You can look at Alkaline for Life. We'll be posting several articles on this. But the most interesting term was recently we have seen research suggesting that, documenting that certain coronaviruses, and there's many types of coronaviruses, but the ones they studied were pH dependent. In other words, they really liked an acidic environment. They did not thrive so well in an alkaline environment. So it's just another great reason why we're going to pay attention to that pH balance. We pay attention to pH balance because it can be an indirect measure of mineral reserve. In addition to alkalizing itself, will put the tissue in a more healthy state, make the cells more able to function appropriately. If you've heard my work, you know we're always saying more fruits, more vegetables, more nuts, more seeds. Everyone is jumping on that bandwagon now as a great way to boost immunity. We add that it's a great way to balance the pH. Many people need additional supplementation of these minerals in alkalizing forms, but starting with the food, great idea. And all of us, even myself, I have to resist the temptation to grab a snack food, sit down and have those steamed vegetables with some nice salad dressing. Try to get the fruits, vegetables, nuts, and seeds, because pH, it looks like it's going to make a big difference to immune resilience. It's interesting, this article with the French minister talking about telling people not to use ibuprofen, that's been taken off the internet. And I just saw that the World Health Organization is saying, no, go ahead and take ibuprofen. It was also interesting that our blog that I wrote on 9,000 cases of healing with high dose vitamin C, that was simply a scientific report of Robert Cathcart's work. Cathcart was a physician in the US who, during the 50s, 60s, 70s, treated 70,000 people with high dose oral vitamin C for pneumonia, for hepatitis. They healed polio with this. It's a remarkable history. It's all published. All I did was report on this, and it was taken off the internet. Of course, the agencies are trying to prevent misinformation, but this talk of vitamin C being helpful to boost immunity is not misinformation. And it's really important to look at the researchers themselves, the doctors themselves who treated thousands of people. We have some links to all this information on a link on Alkaline for Life, which often takes you back to the Orthomolecular Research Medical Group, which was a group founded, of course, in Linus Pauling's theme of using vitamin C as such a great protective nutrient. So if you take the time, no matter what the problem is, kind of let's go a little deeper, try to find the cause of it. If you are using ibuprofen or have that kind of pain, we of course prefer the quercetin pomegranate formulas, but also other things like some other anti-inflammatories that there are on the market today. Natural things can be helpful to you too. I was just looking to see here. And it was, so you can find some. So Tylenol, for example, is one of the standard things people can use. That is not a non-steroidal anti-inflammatory. We like quercetin with proanthocyanins and this pomegranate, but find yourself a natural remedy if you have pain and try to avoid the non-steroidal anti-inflammatories. So another way to talk about going to the root, especially of today's situation, where we're all kind of trying to just readjust to these new series of events. Another way that we want to go to the root is with stress reduction. Stress is as important as any other factor to the detriment of our health, I would say. I want to just tell you about a new Finnish study, and we're going to give you this link to the study in Finland. They took their whole database, thousands of people, and they looked to see what affects life expectancy. And as you might know, smoking reduces life expectancy. They calculate by 6.6 years. Diabetes reduced life expectancy by 6.5 years. But heavy stress reduced life expectancy by almost 3 years. So it's really important to keep, as we get, kind of wrapped up watching all the news, getting worried, it's good to take our time to realize that this too is going to pass. The vast majority of people are going to be just fine. We need to take our precautions. We need to follow our social distancing and be very careful that we don't get a total viral load, that we minimize as much as possible our exposure. But know that the things we can do within ourselves, the gentle exercises, the meditation, we offer every morning. Gina offers some yoga online, some meditations, breathing exercises, kind of to gain our center once again, because you can take 3 years off your life just with stress. In the same study from Finland, they found that exercise, actually, they looked at 30-year-old men, and that exercise, the people who had lack of exercise lost about 2.5 years of their life, even beginning at 30 years of age. If at 30 years of age, they didn't exercise very much, they lost 2.5 years over the long haul of their life. And on the positive side, they found that people who ate fruits and vegetables lived a bit longer, especially in this case, they found the fruits and vegetables were both helpful, perhaps the fruits a bit more, and that vigorous physical activity decreased the risk of death by 22%. So we may be kind of in social isolation here, but I think tomorrow it's going to be warm. They're saying it's going to be 65 in Syracuse. So you bet I'm going to be outside. I'm going to be on some golf course where there aren't many people around at all. And I'm going to get some good outdoor exercise. My sister in Oregon, they've been in social isolation for some time now. She goes birding, goes out in the country, get some fresh air, stay your distance, but the physical activity, maybe it's a good time for all of us to develop a more significant physical activity program. And when it comes to bone health, we know that we must really build strength, build muscle in order to build bone. So maybe it's time to develop your own strength training program. If you get a chance, look at the Australian Bone Clinic, what they're doing. You can find them online. And one of these days, I'll have Dr. Beck as an interview with us. Just before we close, I want to answer one question someone asked just yesterday. They asked this question about osteoporosis, and they specifically wanted to know, does having osteoporosis make your immune system weak? Well, it's kind of a complicated question in that a person can be told they have osteoporosis just because they have a low bone density, like minus 2.5 T-score, but they may be perfectly healthy and strong, and they may just be a thin person with smaller bones that gets a smaller reading. But let's say true osteoporosis, where a person has had a needless fracture, where it's documented that their bones are weak, does that make your immune system weak? Well, no. I mean, osteoporosis doesn't make the immune system weak, but osteoporosis, if you fracture needlessly, it's a sign that something's going on, that the body is not able to repair itself perfectly. Some small trauma, you fall from a standing height, some small trauma, and you break a bone. It's not that it's going to cause immune weakness, but it does show probably you should really think about, are there any causes for this bone weakness? Do I have enough vitamin D? Am I getting all the 20 key bone nutrients? Is my pH in line? Is there a medical problem behind this? Our betterbones.com website has 1,000 articles on bone health, including a medical osteoporosis workup that you can look and see. Should the doctors be testing for something? If you have a needless fracture, it's not going to weaken immunity, but it's a sign that the body is not repairing itself. And you certainly will need all the nutrients that we suggest, and all the alkaline diet, and all the ways of building resilience that we talk about in the Better Bones program. Well, feel free to send your questions. We want to try to be useful during this period. We're certainly doing well, and we hope that you're all doing well and thriving. And tomorrow we're going to talk about a couple other little aspects, maybe some more particularly about creating resilience, how in your own life you can create more resilience during this particular time and always. In the meantime, feel free to send the questions. As long as there's an interest, we'll keep doing these little few-minute talks at 1 o'clock in the afternoon. I wish you all well. May the divine grace shine on us, and we pass through this difficult phase quickly. Talk to you all tomorrow. Bye-bye.